You know that feeling, right? Waking up every morning hoping you're making the absolute best choices for your kid's future. We all do the research on their diet, their schools, we nurture their growth. But when it comes to their smile, which is just a huge part of their physical health and lifelong confidence, by the way, a lot of us find ourselves completely in the dark. If you've ever found yourself doing frantic late-night internet searches, wondering if your kid's teeth are coming in right, or panicking that you've waited too long, just take a deep, reassuring breath. You are in the exact right place. Welcome to our explainer on pediatric dental health. We're going to completely demystify this whole journey for you, looking strictly at the science-backed facts.
Okay, let's dive right into this. We have to address the absolute burning question that kicks off all those frantic searches. When is the exact right time for kids' braces? Like, is 8 years old just way too early? Are we rushing into expensive treatments before they're even actually needed?
Well, the answer is a resounding no. Seriously, I want to shatter a really widespread myth right here, right now. This whole idea that you have to wait until your child is a full-blown teenager with a full set of adult teeth to finally see an orthodontist, it is completely outdated, and honestly, it can be really, really costly.
To really understand why, let's look at a tale of two completely different paths. First up, we have Emma. Her parents noticed she was a chronic mouth breather, so they took her in for an evaluation at age 7. She ended up needing an expander for just 8 months to widen her jaw, and then 6 months of mild aligners when she hit 12. The result? A perfect smile and a totally open airway, completely pain-free. Now, on the flip side, compare that to Liam. His parents figured braces were just, a teenage rite of passage, so they waited until he was 14. But by then, his jaw had completely hardened. Fixing his severe crowding took years of really complex, painful braces, and get this, they actually had to permanently extract 4 perfectly healthy adult teeth. So 2 similar kids, but 2 radically different realities.
Which brings us to Section 1, the golden window myth and the science of the growing jaw. Let's dig into the actual clinical why behind Emma and Liam's radically different experiences. It literally all comes down to the maxilla. That's your upper jaw. Now, in young kids, this bone is not just one solid locked-in piece. It actually consists of 2 unfused, highly malleable halves. So when an orthodontist looks at a 7-year-old in that mixed dentition phase, meaning they've got a mix of baby and adult teeth, they aren't just looking at the teeth you can easily see. They're actually acting like architectural detectives. They use X-rays to analyze that soft bone hiding beneath the gums, specifically hunting for hidden impactions or missing teeth.
The absolutely crucial difference here comes down to bone maturity. At age 7, you've got this soft, highly responsive bone. An orthodontist can gently guide and widen that jaw with specialized appliances. It's kind of like shaping clay. But flash forward to age 14 or older, that bone has hardened. It's fused. It's totally mature. Trying to move teeth within that mature structure takes vastly more force, exponentially more time, and, like we saw with Liam, it often means pulling teeth or even resorting to invasive surgeries. All right, moving on to Section 2, 5 critical warning signs you can spot at home. The best part here is you don't even need a dentist referral to be your child's health hero. You just need to know what to look for.
So, here are the 5 really loud indicators that your child might have some underlying structural issues. And to be totally clear, these are not things they're just going to grow out of or that will magically fix themselves. We're looking out for thumb sucking and mouth breathing, the early or late loss of baby teeth, severe bite misalignments, physical jaw pain or chewing difficulty, and finally, noticeable speech impediments. Let's break these down real quick.
Let's start with that first warning sign. Now, thumb sucking is totally normal for infants, right? But if it goes on too long, it literally physically remodels the face. It pulls the upper jaw forward and shoves the lower jaw back, creating an open bite. Along those same lines, chronic mouth breathing forces the tongue to drop down from the roof of the mouth, and without the tongue up there acting as an internal support, the cheek muscles just compress and narrow that upper jaw. This leads directly to crossbites and a lengthened, stretched-out facial profile, which clinicians call adenoid facies.
Warning sign number 2 is all about the tooth fairy's timeline. Baby teeth are definitely not just temporary throwaways. They are nature's vital, perfectly sized space maintainers, holding room for the adult teeth down below. If a kid loses a baby tooth way too early, maybe from decay or a bad fall on the playground, the neighboring teeth will rapidly drift right into that empty space. That completely blocks the adult tooth from coming in and causes severe impactions. But on the flip side, if baby teeth overstay their welcome, the adult teeth just take the path of least resistance. They often erupt right behind the baby teeth, creating what we call shark teeth. Signs 3 and 4 are all about alignment and function. Does your child have a deep bite, an underbite, or a crossbite?
Or maybe they complain about jaw pain, or you notice they totally avoid eating hard foods like apples or carrots. These functional issues are absolute red flags. A bad bite puts massive, uneven strain on the TMJ, those are your jaw joints and the facial muscles, which can actually cause chronic headaches. This is a clear, undeniable signal they need structural help while that jaw is still actively growing.
And rounding out our warning signs, we have speech. Noticeable lisping, whistling sounds, or having a really tough time pronouncing certain consonants like S or T are super often caused by a physical, structural dental barrier. It's not just a linguistic thing. An open bite, for example, makes correct phonetic tongue placement physically impossible. But the amazing news is, an orthodontist working alongside a speech pathologist can completely remove that physical barrier.
Okay, let's jump to Section 3, the solution. We are going to completely demystify two-phase orthodontic treatment. Now, what's really interesting about this slide is that when a lot of parents hear the phrase two-phase, they instantly panic. They think it means their kid is going to have nonstop braces for a solid decade, but that is simply not true. Take a look at this timeline. Phase 1 happens early, between ages 7 and 10. Then, and this is super important, there is a resting period. All appliances come off to let the rest of the teeth erupt naturally. Finally, Phase 2 kicks in around age 11 or 12 for that comprehensive finishing touch.
As you can see, there is a massive clinical difference between these two phases. In Phase 1, the focus isn't really cosmetic at all. It's all about heavy skeletal correction and making space over a pretty short 9 to 12-month window. And because you get all that heavy lifting out of the way early while the bone is still soft, Phase 2 becomes incredibly simple. Phase 2 strictly focuses on cosmetic alignment and finalizing the bite. Doing it this way drastically reduces the overall time your kid spends in braces during those teenage years.
During that first phase, the treatments are highly customized. The orthodontist might use palatal expanders to gently push those two halves of the upper jaw apart, or maybe partial braces on just the front teeth, or space maintainers. They even use clear aligners now. Yes, believe it or not, they actually make clear aligners designed for 8-year-olds today. Though that definitely requires your kid to be super compliant and wear them 22 hours a day without accidentally throwing them away in the school cafeteria.
Moving into Section 4, life with braces and the devastating cost of waiting. Let's talk about the daily realities of treatment and what exactly happens if you miss this golden window entirely.
Obviously, daily life with fixed appliances does mean you have to temporarily banish the super sticky or incredibly hard foods so you don't snap any wires. But honestly, the single most critical aspect of treatment is hygiene. If they neglect brushing, you end up with these permanent white decalcification stands on the enamel, which nobody wants. That is exactly why your ultimate secret weapon is the water flosser. It is an absolute game changer. It effortlessly blasts away plaque from under the wires where using normal string floss is just way too frustrating for a kid to manage.
But what happens if you just wait? Well, let's look back at Liam's reality from earlier in this explainer. The hidden risks of delaying are horrific. By skipping that early evaluation, a simple narrow jaw issue could turn into needing to surgically break the palate at age 18. It frequently leads to extracting perfectly healthy adult teeth just to force some space. Plus, it essentially guarantees abnormal enamel wear from unnatural teeth grinding, and it sets the stage for lifelong TMJ and jaw pain.
Conversely, acting early is just a massive holistic win all around. Think about it. It saves parents immense financial costs by completely avoiding those future complex surgeries and extractions. It prevents physical trauma to protruding front teeth if they take a tumble on the playground. And crucially, maybe most importantly, getting a smile makeover done before those ruthless middle school years prevents bullying, it massively reduces anxiety, and it really helps guarantee lifelong psychological confidence.
And you guys, this isn't just theory. This is the definitive standard of care. The American Association of Orthodontists officially recommends that every single child should have their first pediatric orthodontic consultation no later than age 7. That is the ultimate science-backed rule to intercept any issues while their jaw is still in that prime, dynamic state of growth.
Every single month you wait, your child's jaw bones are becoming denser, and that golden window for simple, non-invasive early correction is slowly, permanently closing. But the very first step is so simple. It is entirely risk-free. It requires zero commitment to treatment. It's literally just an expert evaluation to see exactly where your child's development stands. So the final question I want to leave you with today is this. Will you open the golden window before it permanently closes? Take that proactive step and secure a lifetime of healthy smiles. Thanks so much for joining me on this explainer, and keep learning.